Exercise as medicine is a philosophy that many physicians are promoting to their patients, stressing the importance of prevention as part of their cure. Dr. Craig Green is an orthopedic specialist. Dr. Green, over the years you've treated thousands of patients. How does the sedentary lifestyle, lack of physical activity, impact on their joint health?
That's a good question, Bill, and thanks for having me. You know, the problem in our society today is that America and all of us tend to getting larger and larger. Food has been more, it's more available now. You can get it quick, it's fried more easily, and people start to put on weight at much earlier age. And the thing about weight is once you put it on, it's really hard to take it off. And the interesting thing, I see a lot of folks with, say, knee pain, for instance. I tell them that, you know, they may weigh 350 pounds, and 1 pound of body weight's about 7 pounds on the knee. And they wonder why their knees hurt. Now, we all have some weight we could lose, but the sedentary lifestyle becomes a vicious cycle because you're not exercising, you gain weight, you put more weight on your joints, and so you exercise less, and it's hard to break that cycle.
Dr. Green, the next point basically is that we tell people that even if they lose a little bit, that a 10% has significant benefits. And maybe you can expand on that, say, hey, a little bit of medicine goes a long way.
Yeah. Well, and I tell them, look, we all have a little bit to lose. But for instance, if I asked someone can you carry around this 25-pound sack of sand all day? And they did, it would hurt their back, it would hurt their knees, it would hurt. I said, and that's practically what some of us are doing right now, is if you could lose that 25 pounds, think how much better your back would feel. Think how much better your knees would feel, your hips, your psyche, even your mental health.
When it comes to your surgery, patient has surgery, recovery is a key concept. A lot of people fail to realize that actually if they lose some weight beforehand, if they strengthen the muscles around the joints, their recovery can be much easier, and the benefits from your surgery can last a lot longer. Can you expand on that?
Absolutely. You know, we send patients to what's called prehab, and that means before surgery we want to get their muscles strong because we're going to create an insult into that knee or to that shoulder or to that elbow that then they're going to have to recover, and the muscles around the joints are going to be the major factor in providing recovery for that. We want to strengthen those before surgery.
On a final note, why is it so difficult from your perspective as a physician to get people to change their lifestyle?
I think it's based on ease of access, and it's easy to get the fried food. I mean, you pass 5 or 10 between here and home. It's hard to pass those up sometimes.
Now, finally, Dr. Green, when you're looking at a healthy lifestyle, how important is it as part of your formula for success?
I really recommend it, and I recommend it as a lifestyle, not just I'm going to try this for 30 to 60 days.
Okay, thank you for being with us. I'm looking forward to having you once again.
Thanks for having us.
Peak Performance Physical Therapy promotes the importance of a healthy lifestyle and pain-free training. My guest is Chris Purvis, physical therapist, athletic trainer. Welcome to the show, Chris.
Thank you, Bill. We're glad to be here again. And you know, this part of the show, we try to use some of our exercise expertise just to help people a little bit, whether it's an old injury or whether it's a current injury or whether they're just trying to prevent an injury that would slow them down. A lot of times in exercise, pain is a problem. So there's always some little tips that you can do to kind of help stay pain-free.
Chris, our focus is on daily activity, and this example, the sit-up, is essential to our quality of life and well-being. People make the same mistakes over and over again. So let's start off with the basics.
Well, you know, the sit-up, the crunch, whatever you want to call it, the abdominal work is one of the basic, and we call it core because it works the core, but it's one of the foundations for the core. So you have to get the basics right to be able to progress from there. And the problem is a lot of people don't do sit-ups correctly, and they feel like there's one way to do everything. We can start off a little bit with just a basic crunch. You know, what we see a lot of injuries that come from the sit-up and from the crunch exercise. And one of the main things that we see is pulling with the head. When the abs are not really strong enough to do what they need to do, we have people that pull and pull. They pull hard from behind the neck, and we create a lot of neck injuries, and we're really not doing a lot of ab training.
Definitely. The next one we see people always think is volume instead of quality, and they use their hips and momentum.
The next thing we see a lot is rolling. The momentum part, whether their feet are locked down or whether they're not, it's getting momentum to roll into the motion, which again takes a lot of the strain off of the muscles that we're trying to work.
The last point, Chris, hip activity. I know you have some strong feelings about that. We talk abdominal isolation and hip activity.
Well, the core is not just abdominals, but it's the hip and the low back and the whole group. So what we've really got to do, what we start on, is a really basic exercise to where the hips are locked in and we're just really working the abdominal muscles is what we want to isolate.
Great, Chris. Now, there's a lot of people, Chris, can't get down on the floor. So what they do, Chris, is they have a difficult time. And what would you suggest using an exercise bench? How do you use it from a therapeutic point of view?
Well, a lot of people see this bench and they feel like it's a decline bench.
Yes.
So it's a high-level abdominal exercise trainer. But what we do in therapy is we start a lot of people opposite. So we use it as an incline bench. So what they're able to do is come down. We don't have to use any momentum. They're able to cross their hands and they'll be able to do a sit-up from a position where they're already inclined, so it takes a little bit of pressure off.
You let gravity help you.
Exactly. And then once they can get to the ground, then they can start on some of those.
Finally, Chris, everybody knows about stability balls. How about a couple of pointers how to use this safely?
Well, the main thing on the stability ball, you want to use it to protect your back. So you don't want to lay all the way back on the ball. You want to put it right in the small of your back. Once you get to this point, you're using it to help hold your low back so you can concentrate on the abdominal work and protect your back at the same time.
Thank you, Chris. Safety and exercise performance should always go hand in hand.